Hello, everyone, and welcome to another episode. In this one, I'd like to answer a question about unusual taste abnormalities and cough after COVID infection because it's one of the questions that I received on the channel, and I'll read the question together with you. I'll read the question to you, and we can maybe discuss about a couple of things that may be going on. And really, at the end of the question, the main thing is should I go see a doctor or wait for some more time if the person has some worrying symptoms? And I think I'd like to just address that because I think too many people wait for too long to go see their doctor. I'm not saying this is what's going on in this case, but if you are worried about your health, always go and see your doctor. That's the logical step. Even if the doctor will tell you, everything's fine, it's probably better to just go and get that answer rather than wait until things maybe get worse. Or maybe there's something that can be done to improve your situation and you haven't gone. So look, let me read the question to you. Let's read it together. If you're watching this, I'll read it. You can read it yourself, but I'll read it to you. So, Tactical Chad, that's a nice username. So, hi doc, I was tested positive about 2 months ago for COVID, and I have recovered for the most part, except for some persistent phlegm that just doesn't seem to go away. I've tried taking acetylcysteine tablets, and it did work to a great extent, but I'm still getting occasional coughs, like maybe 3 or 4 throughout the day. I also feel a slightly metallic, kind of bloodish taste when I cough. Don't know if it's common with respiratory chest infections. I can feel that I'm recovering, but I'm concerned about that persistent little bit of phlegm, whether it will go away on its own or result in something like pneumonia. So should I see a doc or wait for some more time? So, well, the things that are described here, look, it could be a very mild case of residual cough that seems to be slowly improving. It could be some other condition going on. It could be related to taste disturbances after COVID, because this is another possibility. Pneumonia is a whole different ballgame. So let's just try to answer these things. But like I said before, if Tactical Chat, who's written this question, if he's worried about anything, I think the right thing would be to go to the doctor if they're worried about their symptoms. If they're feeling good, well, I don't know. It depends. I cannot know. So from a comment, even though I'm a doctor, I cannot tell you because I haven't seen you. I haven't consulted you. I don't know what's going on. So to give you just a theoretical answer, and let's discuss some parts of this question, I think that might be useful for context. So look, when you've had a chest infection of any kind, COVID or non-COVID, generally you might be left with a residual cough, which may be worse or better, for up to 2 months. That's something that can happen. It's fairly common. Usually, if that cough is improving on its own, you don't have to take much medication, you don't have to do anything, it's just slowly getting better. It's probably getting better overall. The situation is getting better. It's probably nothing to worry about. Generally, if there is an ongoing cough that doesn't seem to improve, that doesn't seem to be getting better after 2 months, it's probably a good cue to see a doctor. Now, what constitutes a persistent worrying cough? It depends on the situation. Obviously, if you're coughing every hour of every day, probably something that you might want to look into. If you're only having a little bit of a clearing your throat scenario where you're just like doing this a little bit and it's slowly getting better, probably there's not much to worry about. But then this situation with persistent phlegm after COVID infections, it is a fairly common problem. Now, the person who wrote this comment said that they were trying to take acetylcysteine. Acetylcysteine is a medication. It's taken as tablets. It usually makes the mucus a little bit more fluid, so it's easier to bring it up sometimes. That doesn't mean that it's for everyone. So if you're having a dry cough, probably the acetylcysteine won't do much to help. Also, if you're taking the acetylcysteine excessively, so if you're taking too much of it, it may actually cause more irritation because of that mucus that starts to be moving up and down because it's more fluidy. It may not always help. So I would say unless a doctor has prescribed that to you, I wouldn't necessarily go for that. So I would say discuss with someone before taking any kind of medication. That's quite important. The other thing, moving on through the comments, so person who wrote it says that they get occasional coughs, like maybe 3 or 4 throughout the day. Now, I don't know what that means. Is it 3 episodes of severe coughing or just coughing a little bit like and then some time passes, you have another 2 or 3 coughs? That's probably very little cough. But if you're having these episodes where you're really, really struggling with a lot of coughing and it's not improving, again, something you may want to discuss with someone. Then the slightly metallic, kind of bloodish taste when they cough. Now, this may not necessarily be related to chest infections, so this is what the question was about. Sometimes it can be related to acid reflux from your stomach. So a lot of people struggle with gastroesophageal reflux, and actually, this indigestion, this acid reflux, it was one of the most common causes of an ongoing chronic cough. So sometimes that acid moving up through the esophagus, some of it being inhaled in the lungs, even the vapors that you sort of regurgitate and inhale, if they're acid, sometimes they can irritate the airways. It can lead to a chronic cough. And it's a common problem, especially if your diet's not really that great, if you're eating really large amounts of food before going to bed. These sort of things can happen. So it's really important to think about whether that might be a problem. So if you're suffering from a lot of indigestion, you feel a bit of heartburn, acid coming up, you've also got a cough, you may want to look into that. Maybe talk to your family doctor, your general practitioner, just to see if there's anything you might want to try for that. If you might want to make slight adjustments to your diet. So for example, to eat less acidy foods, less coffee, less Coca-Cola, less, fizzy drinks, things like that might be worsening the acid. Avoiding, like I said, very large meals before you go to bed. So that's a common one. And sometimes it may help to do mechanical adjustments. So for example, if you're coughing a lot when you're lying flat and you have acid reflux, you may want to consider either propping yourself up with more pillows, or even better, if you can roll up some sort of a blanket or something else that you can put under the end of the mattress to sort of flex the end of it. So your torso is slightly elevated, maybe like at a 10-degree angle, 15-degree angle, just slightly elevated. So that may help to keep the acid down in the stomach. So that's something that can cause this sort of metallic taste. Now, if it's a bloodish taste, I'm not sure if that's related to the cough. If you do see blood in your sputum that you're bringing up, it's again something you may want to consider talking to your doctor about. But then again, most people will generally go see a doctor if they see that they're coughing up blood. So I mean, obviously, it's one of those common sense things. It can happen sometimes with chest infections. It's not always the sign of something completely terrible. So just things you need to discuss with your doctors. Don't be afraid to go see a doctor, even if everything's okay, more or less. Sometimes just having that consultation, having that medical opinion in your case might be better. You may discover something that you didn't know you had, or something that may be easily treated, something that's quite okay. So the other thing is, if that little bit of phlegm that was mentioned in this comment will go in on its own or result in something like pneumonia. So that was the end of it. Now, pneumonia is a fairly severe chest infection. So when someone gets pneumonia, they don't generally feel well. So besides coughing, they usually have a lot of other symptoms. They may feel completely tired. They may have sweats. They may feel like they're ready to faint. So you have general symptoms which are really strong. You may have a high temperature. There's lots of things going on. Someone who has pneumonia actually feels really sick. That's generally what happens. And just because you are coughing a little bit at this time doesn't mean that cough will get much worse and it will turn into pneumonia. That cough can be triggered by many things. I think I've got another video on the channel about causes of cough, so you may want to look up cough on my channel and you might find some more causes for that. So it's not always something to do with the airways. It can be related to post-nasal drip, for example. So if you've got some ENT problem, you've got chronic rhinitis, your nose is always runny, you've got some allergies, and that secretion is running down the back of your throat, that can also be related. That can be also causing the cough. So acid reflux, like I said, some type of high blood pressure medication can also cause a chronic cough. So there's quite a lot of things going on. So of course, if you're getting pneumonia, if you're feeling sick, if your cough worsens, you're bringing up more phlegm, you're feeling a lot of breathlessness, there's a lot of other things going on, definitely discuss it with a doctor. Don't wait. But if after a chest infection, just to conclude, if in the first 4 to 6 weeks, maybe 8 weeks, the cough is slowly getting better and you seem to be feeling better overall, it's probably just a residual cough, which is more or less normal. If that cough is worsening or really staying the same, don't seem to be getting any respite from it, it's probably a good idea just to run it past your doctor to see if there's not something else going on, like a complication or something that may have happened, if there's some other condition that's driving the cough that may be treated, because having a chronic cough is really difficult. And sometimes it can be quite hard to find the exact cause for it. But this is what I wanted to say here. Just one more thing, just specific to COVID. A lot of people who have suffered with COVID have taste abnormalities. So that bloodish taste, that metallic taste, might actually be related to a post-COVID, long COVID situation. I'm not sure what the exact treatment for that would be, to be perfectly honest with you. In most cases, though, most people who have suffered with COVID tend to get better. So I hope that's slightly reassuring. But if you're feeling unwell, it's always a good idea to talk to your doctor, even to go for an annual checkup, even if everything's okay, to speak to your family practitioner, general practitioner, just to see if everything's all right. If you need to look into anything, it's probably a good idea. Just like you're servicing your car every year. Servicing your body, it's not a bad thing. The yearly MOT, this is what they say in Britain. So to do your body's checkup. So anyway, this is what I wanted to discuss in this episode. Hopefully that was helpful. If you have further questions, do leave them in the comment section on the YouTube channel. I like doing these videos. This one, again, was a little bit maybe all over the place because I tried to cover all the things in the comment. But anyway, if you have further specific questions, I'll try to discuss those as well. Thank you very much for listening and have a good day and good health. All the best.